Hi, I'm Mike Motley with the Arkansas Center for Health Improvement. Arkansas is doing a lot of great things to improve our healthcare system. A major part of that is the Payment Improvement Initiative, and within that is the Comprehensive Primary Care Initiative, which supports 69 practices throughout the state to move towards a more patient-centered model of care delivery. So far, we've seen a lot of great success stories, and one of those is Sama Healthcare in El Dorado, Arkansas. So with me today is Pete Atkinson from Sama Healthcare. How you doing today,
I'm
Pete?
doing great, Mike.
Thanks
Thanks
for
for having
joining
me.
me. No problem. So I'd like to ask you a couple questions. So how has joining the initiative helped you guys make some of the changes that you wanted to make at Sama?
Well, the biggest thing they did was provide the financial resources to make those changes. We had tried to make changes earlier on, and just honestly did not have the financial resources to hire the staff we needed to. So that's probably the best thing for us anyway. For as far as CPCI, it enabled me to hire 12 more people. We are in the progress of hiring 3 more nurse practitioners and a few more nurses on top of that already. So it's been pretty exciting. We're building teams. It's been a year now. We're seeing some improvements and whatnot, but the finances in order to hire the staff we needed to transfer from being reactive to proactive is by far the most important thing that we've gotten out of CPCI.
Sure, that's excellent. So I know you guys have 4 physicians under one roof there. Can you kind of describe to me the team structure you've built around those physicians and your kind of pods that you have?
Sure. One of the challenges that we ran into before CPC was the continuity of care. We have 4 physicians and 2 nurse practitioners under one roof. Depending on when a patient came in, if a physician was on vacation, let's say, they might see another doctor or another nurse practitioner that was, they really didn't know them. They had access to their medical record, but they didn't know them as an individual.
Sure.
So what this has allowed us to do is create teams. I have a physician, a nurse practitioner, 3 LPNs, and a care coordinator all on the same team. And what that allows me to do, again, if a physician's out of the office, then the patient continues to see that team. They know their nurses. They're dealing with that nurse practitioner. So there's not this every time they come in trying to learn,
Sure.
get to know each other. There's already that relationship, so it improves the continuity of care.
Great. So on the patient side of things, I mean, I know you guys have taken a colorful approach to patient engagement.
Yes.
So if you can kind of just explain that, and also just overall how your patients have responded to the transitions that you've made
Okay.
so far.
One thing we did is we wanted to actually rebrand SAMA as a whole around the patient-centered medical home concept, team-based. I've been a soccer coach for I think 30 years, or played soccer for 30 years and been a coach for a long time. So color association and team association and those types of things are something I'm very familiar with. So the first thing we did was we actually rebranded, came up with a new SAMA logo, and we have 4 teams, so we came up with 4 colors, one for each team. Our nurses stations are actually painted in that color of that team, and our team members, our nurses on each team, are wearing scrub jackets of that color. So it's really neat. You walk through, you can see what staff member belongs to what team, and then we also have a lot of support staff, and we put them in black. But it looks really sharp, looks very professional, and the patients has responded great to it. They like the team concept. Again, if they're walking through the building and they're on Team Orange, which is Dr. Bevel, let's say, they see somebody in orange. That's somebody that's on their team. Someone is watching out for their health care.
That's great. So you guys have been doing this for about a year now in the initiative. Are there any kind of early results that you would care to share, like improved workflows or improvements in your quality measures, things like that?
It's still kind of early to get definitive data, but the early data is showing that we are definitely improving. A1Cs for diabetics is just one example. We're also, my care coordinators are the proactive piece of this whole thing. They are calling people, telling them that they're due mammograms and whatnot. And so we've actually found several cases of cancer, both breast and colon, in the very, very early stages. And these are things that we might not have been able to find had we not had those care coordinators in place in providing those preventative services.
Great, that's excellent. So I guess overall, would you say that the transition that SAMA is in the process of making, has it been successful so far, and kind of where do you see it going for your clinic?
It's absolutely been successful. We've seen major changes, and I still feel like we're just getting started. Year one was just all about change. We had a lot of staff turnover because of change, but it's getting better every day, and it's again just we're seeing that actual transformation from reactive to proactive healthcare. The patients are starting to learn about it. They're buying into it. They're asking questions via our portal, and it's only going to get better.
That's great. Excellent. Well, thank you very much for your time today, Pete.
All right, Mike. Appreciate it.
And for more information about Arkansas's Payment Improvement Initiative or the Patient-Centered Medical Home Model in the state, please go to www.paymentinitiative.org or aci.net. Until next time, thank you very much.